Hi, I'm Dale Sherbeck, and welcome to the HQ, a CHA Learning and Healthcare Can podcast serial where we dive into healthcare issues and topics from the perspective of its people and discuss them with those that are leading in the health system. Together, we'll try to unpack these topics and learn what actions are being taken to innovatively solve them today. I think most of us think we implicitly understand what is meant when we talk about simulation. Many might point to the simulators used to train pilots who can safely learn how to fly a specific plane or practice certain operations which might be life or death if performed in the air. Healthcare is no stranger to the use of simulations either, and there are thousands of examples of what might be included in this list. The growth and use of simulation in healthcare remains a tremendous opportunity to improve all aspects of the triple or quadruple aim, and certainly to reduce costs, improve quality and safety, and outcomes in general. And while that could be our conversation today, instead, I want to explore the role that simulation can and does play in all things related to our critically important health human resources. To discuss this, I'm joined by Dr. Tim Willett, President and CEO of Simulation Canada. Tim has been working at the intersection of healthcare education, technology, and leadership since 2005. He is passionate about the transformational and overdue value simulation is bringing to the healthcare education and delivery sectors. As President and CEO, Tim is responsible for leadership and the day-to-day operations of Simulation Canada. He is honored to be part of the small but mighty team and the network's passionate nationwide community. Tim received his MD from the University of Ottawa and a Master's of Medical Education from the University of Dundee in Scotland. He has served as a curriculum developer and educational researcher for the University of Ottawa, the CRI Critical Care Educational Network, and the Royal College of Physicians and Surgeons of Canada. He has served on the executive committee and as co-chair of the Competency Working Group of the MedBiquitous Consortium. Hi, Tim, and welcome to the HQ.
Good afternoon, Dale, and thank you.
Yeah, thank you for joining us today. I've really been looking forward to this conversation for some time. So, let's just jump into it. So, perhaps we could start the conversation today by ensuring everyone listening has the same appreciation of what simulation is, and what value it does bring to healthcare.
Yeah, that's a good place to start because everyone has a different idea in their head when you say simulation, and many may think of the mannequins that have pulses and that you can intubate and that are used for replicating high acuity medical situations, and that's part of simulation, but certainly not the extent of it. So we define simulation as a replication of some aspect of reality for the sake of education or quality improvement. So really, it's a technique. We're trying to imitate some part, not necessarily all parts of a real clinical situation, and then applying it for either educational purposes or quality improvement or patient safety purposes. So we in the field talk about modalities, which is the way, the technologies or techniques you use to create that simulation. In some cases, yes, we do use the mannequins that have the physiology.
Right.
But it spans a gamut from having actors who are trained to play people or patients in a certain situation, to virtual reality, to computer-based or screen-based simulations and serious gaming, and a lot of other emerging technologies that enable us to recreate some clinical situation.
Fascinating. So I'm sure you're going to bring up some more of those examples as we continue the conversation here. So, I dare say that as we enter 2023, there are a few people in Canada that don't know we are in a health human resource crisis that is growing increasingly dire every day. But for certain professions, the call is simply to create more seats in our medical schools, open up more positions for nursing students, as an example. And then others are quick to respond and remind is that we just don't have enough spaces for those students in our healthcare institutions. So, I mean, what is your take on this, the role that simulation can play sort of in helping us, I guess, in terms of our recruitment and development of new health professionals and helping us out of this crisis?
Yeah. And Dale, that's something I'm hearing from our members who are colleges and universities and hospitals across Canada too, is this being stuck between a rock and a hard place, where sometimes there's certainly pressure to increase or maintain enrollment of healthcare professionals. In some cases, there's even funding from government. but there's not the clinical space to take on more students in many clinical settings, and that becomes the bottleneck. There's growing evidence, and at this point, fairly solid evidence, that simulation, no doubt, is a strong pedagogical method and accelerates learning faster than most traditional educational techniques. There's additional evidence that simulation can help learners achieve levels of competencies we need of them at the time that they graduate, by creating hybrid curriculums where some of the clinical training is done in simulation and some of the clinical training is done in the hospital or other healthcare setting. So the conversation in simulation circles now is, how do we optimize the limited clinical placement time we have and everything we know about simulation in order to create the best combination of clinical learning, simulation-based and placement-based clinical learning, to optimize the educational outcomes of our students. And so we're seeing things like simulation being used to prepare students for their clinical placements, for them to learn some of the routine practices and day-to-day activities that they'll be doing in the clinical placement, so that they're ready to go when they get into, I'll say hospital for argument's sake, but recognizing this might be a community placement or long-term care.
Sure.
But they've got some of those foundational skills that they'll be using. And then in the clinical setting, the focus isn't so much on learning a particular skill or seeing a particular condition for the first time, but rather understanding it in context and learning how healthcare teams work, learning how healthcare systems work. But some of that foundational knowledge, the foundational problem solving, the psychomotor skills can all be developed quite effectively and completely safely in a simulated environment. We're also seeing hospitals use simulation to make sure students get certain experiences. So as I'm sure you can appreciate, if you're a nursing student going through your emergency rotation, you may or may not see a trauma, depending on which emergency room you're in and what happens on the shifts that you're there. One may come in the door, one may not. And if it doesn't, then you've missed the opportunity to try to learn how a trauma team responds when a trauma comes through the door, or any other medical emergency you can imagine. So by creating a standard simulation curriculum, we can make sure that students are exposed to certain conditions or certain situations that we want to ensure that they have worked through by the end of their training.
Yeah, you don't want to wish for a gunshot wound so you can practice, right?
No.
But you certainly want those people prepared for that when it's going to arrive. So, I mean, are there other advantages, in use of simulation compared to, a more, I guess, traditional way of observing, watching, and practicing? I'm just sort of thinking, there may be detractors out there that would say, but it's simulation, it's not as good as it, or it's, it takes away that the reality, and therefore does it, it's less than, the quality education they might receive otherwise.
So in simulation, nobody is advocating that simulation completely replace clinical placement, because nothing can recreate the real complex social, environmental milieu of actually working in a hospital. What we want to do is expedite learning so that we can make as efficient use of that time in the hospital as possible. So if you take, a basic skill, let's talk about inserting a central line, for example, which is something that happens regularly in acute hospital settings. When I went through medical school, it was see one, do one, teach one. I think when I went through medical school, I didn't even have the opportunity to see one before I was asked to do one under supervision. This was not an ethical practice. This was not a safe situation for the patient. The procedure went well, everything was fine, but this was not a good educational paradigm.
Mm-hmm.
So now what we can ask of students is to see one, to simulate one. If they need more refinement of their skills, simulate another, until you achieve a certain level of comfort and a certain level of skill,
Mm-hmm.
and then transfer that learning to the bedside. And indeed, there's tremendous evidence now that the learning in simulation does transfer to the clinical setting, that it does reduce the stress load and allow learners to focus more on the quality of the task that they're doing, rather than having to think about what they're doing. And in some cases, and the reason I chose Central Line is it's a perfect example, that there's strong evidence that clinicians who are trained on simulation and achieve a certain level of competency in simulation have lower levels of bloodstream infections and lower level of sepsis resulting from the procedure itself. So there's even growing evidence that simulation-based training can translate into improved patient outcomes, reducing adverse effects, and even reducing cost of hospital stays.
Yeah, that's huge. So coming back to the question, I guess, about creating more space for graduates, or people doing residencies or things like that, I guess, right? In terms of the use of simulation, so are you, I guess, to make sure I'm capturing it, because I don't think you said it explicitly, but it can reduce the length of time for some of those things as well in terms of the burden, so that the use of simulation could improve the number of spaces in our institutions for people to do their clinical practicums or residencies or things like that. Or I guess, is that the suggestion? Or
Yeah, it is. And there's been multi-site studies showing that this can be safely done. And there's schools across North America, including some in Canada, that are already doing that. So they're reducing the number of hours that their students spend in clinical placement, and increasing the amount of time they spend in simulation instead.
and just roughly, like, is it reducing things like by 10%, 5%? Do you have a sense? Or
It varies,
yeah,
and at this point, it's a bit of an art and a science.
yeah.
In some cases, that's up to 50%. So some of the studies that have been done have taken what would be, for argument's sake, a 40-hour clinical placement and reduced it to 20, and shifted the other 20 hours into the simulation lab.
Right. So that's almost doubling the number of seats then.
And theoretically, yeah.
Yeah.
The challenge, or maybe it's not a challenge so much as the requirement from the simulation perspective of course that the simulations be well done.
Mm-hmm.
And simulation as an educational technique, as you pointed out, starting in aviation decades ago, becoming much more popular in healthcare around the turn of the century, has a very strong body of best practices. So we know what kind of techniques, what kind of training for educators, or as we call them, simulationists, is needed. What kind of work needs to go into creating a simulation scenario, preparing your learners for it, and debriefing your learners after, in order to make it a safe and effective learning opportunity. So that's really the challenge from the simulation perspective, is now ensuring that quality, so that students really are prepared when they go into the clinical setting.
Sure. So, I'm assuming you can get to that. I guess that what I'd also then be hearing from you is that it also creates an opportunity for almost a standardized approach to some of that teaching as well. Right. So to make sure that every student is necessarily getting the same exposure, the same procedures, the same, right, the same opportunities to practice or things like that.
Yeah, absolutely. And it's one of the great benefits is, yes, you could have that standardized curriculum, but it can also be individualized.
Yeah.
Um, and a learner who needs a few more tries on a simulator in order to get something can do that.
Mm-hmm.
Um, a learner who needs a bit more practice seeing undifferentiated presentations of chest pain in order to refine how they work up chest pain and come to a diagnosis from this nebulous presentation can practice some more cases and work on their clinical reasoning skills. So
Cool.
it can be both standardized and allow for more individualized educational experiences.
Oh, it's the perfect sort of, recipe, I think, for individualized learning and giving people the best opportunity to be the best that they can be. So, I mean, based on what you've shared, certainly we can improve the supply of our health professionals by leveraging simulation. Um, what about getting these new hires ready to say into new organizational roles and things like that, and onboarding, that part of the process?
Mhm.
Does simulation play a role in that next stage of their development?
Definitely. And I see more and more hospitals across Canada starting to use simulation as part of the onboarding or ongoing professional development of their staff. Um, so we know that transition from school into practice is a challenging point in anyone's career development, um, because there are certain things about being the one responsible, about being the one in practice, and about practicing in a certain setting, right? In a certain hospital that has its own culture, that has its own workflows, that has its own electronic medical systems. And there's a learning curve to that, as well as a confidence building curve. So we see simulation in several hospitals I know of across Canada. It's being built into that onboarding process. Again, there was one study that comes to mind out of the US where they
Mm-hmm.
compared their traditional onboarding process, which involved a series of lectures and then buddy shifts,
Mm-hmm.
to a more simulation-based curriculum. And what they found is that the number of buddy shifts that new hires needed to transition into the workplace was cut down so much that it was markedly cheaper to run the simulation community than it was to pay staff for all the buddy shifts that
Mm-hmm.
would be otherwise needed. So it was actually, not only safer for patients, but economically, it made more sense to use the simulation-based onboarding program.
So building more independence in those people, is that sort of I guess, the outcome of that?
Yeah, and using the simulations to help them learn hospital processes and workflows and policies and procedures, so that they don't need as much time on the buddy shifts um, to feel the confidence that they need to
Yeah.
begin independent practice, but also to know those processes.
So, so building on that, I guess, it just thinking about what the person um, experiencing the simulation, right, or acting. I'm not sure what the right word is, but the actor, I guess. I'm not. I guess I don't want to use that word because that suggests the actors are the simulations. But the person who's going through this process, what is, it says it builds more confidence and things like that. But how do they, in other situations, respond to getting a simulated experience versus a non-simulated, right, a more real experience? I mean, I know I was asking you about, the more general perception of that at the earlier, but from the individual's perspective, what does it change in terms of their perceptions or outcomes, I guess?
So I think it's important to remember that the generation graduating from health professional training now is used to simulation. It's
Mm-hmm.
it is a standard part of most health professions training programs now. So they're entering the workforce used to learning through simulation. And um, when one starts in learning, in simulation as a learner, it is intimidating because you're being asked to do things in a somewhat not perfectly ever, but somewhat realistically environment and act as if you're a professional. And it's a position of vulnerability because you know there's opportunities for you to make mistakes, you know you're being observed. So we work hard to create a culture of safety and learning in the simulation space. And once students get used to that way of learning, they're quite accustomed to it. So transferring it and continuing that simulation-based learning in a continuing professional development um, would almost be an expectation, I think, of most people coming out of training programs these days. Um, for those who are used to it, have are comfortable with this learning modality too, like I said, what we see reported time and time again is that the simulations allow them to feel more confident and more comfortable and reduce their stress levels when they do make that transition into the clinical environment, or when they do begin that independent practice.
Hmm. So a lot of the examples that you've given to this point in time, I think, inserting a central line or even some, adherence to policies and procedures and things like that. I mean, they're step-by-step things. They're technical or clinical by their nature. Um, and certainly I can see, with the right investments, right, creating simulations for those, makes it's easy for us to understand and perhaps relate to. Um, what about those other parts that are perhaps a little bit more unpredictable, like the interactions with people, the social skills, soft skills, as we might describe them? Does simulation play a role in helping those parts of our development?
Yeah, definitely. Absolutely. You're right that historically in simulation focused a little more on the technical skills. And increasingly, we see some incredible educational work being done when it comes to interpersonal skills, collaboration, communication, teamwork during a crisis, and situational awareness, and managing a team during a crisis, in improving patient-centered care, and most recently, as our healthcare professionals shift towards um, a greater emphasis on trauma-informed approaches, on patient-centered care, um, on anti-racism and anti-discrimination, culturally safe care. We see simulations being used to help people use the right language in the right way, use the right body language, to make sure that healthcare experiences are effective and positive and safe for a whole diversity of healthcare system users.
Hmm. Uh, Really interesting. So, I mean, are they role playing, or I guess, how does the simulation play out for something like that?
Yeah. Um, at the kind of more basic end, one major national project we're involved in right now involves creating virtual or screen-based simulations, which are almost like serious games that learners can access on a computer.
Hmm.
Some of those are being built from a communication or relationship building perspective, and learners have to choose what they're going to say and how they're going to phrase it in order to build a relationship with a patient, or manage a conflict with a colleague. So that's maybe on the more basic introductory end. And then on the more sophisticated end, you would use standardized patients, or what's called simulation participants. And these are professional actors who are trained to play um, people in a certain role. So
Hmm.
I've been involved in training around end of life, where practitioners have worked with these trained actors to work through processes of breaking bad news, and talking about very difficult end of life decision making in the intensive care unit with patients, or and families are navigating situations, um, hypothetical situations where there's a family, and some people in the family believe it's time to stop intensive treatment, and that everything that can be done has been done, and let nature take its course. And others in the family adamantly believe that everything that can be done should continue to be done, no matter how invasive. And those are incredibly difficult social situations, but we can, with very strong actors, we can recreate these um, and help practitioners learn how to navigate situations like that.
Would it allow them to sort of, I guess, from a different scenario-based sort of approach, allow them to see different kinds of outcomes, like how to arrive at a different conclusion, or how, um, your choices might reduce, I guess, yeah, to lead to different outcomes or behaviors, and maybe both maybe desirable, but how do you practice, I guess, getting to a certain place, or
Yeah, yeah. How to practice getting to a certain place, but also recognizing um, our internal biases and what could turn into or feel like a conflict
hmm.
with a colleague or with a family, rather rather than allowing it to become an intractable or even a escalated but resolvable conflict. Reframing it and focusing on um, empathy and relationship building and guiding people through a difficult time or a difficult process. So yeah, we can see those changes um, in self-regulation and those changes in behavior through practice.
Yeah, I mean, like things like empathy, like it's such a, so critically important, and such a hard one to sort of put your finger on. Right, it comes up in so many parts of, I guess, our competency building sort of, I guess, roadmap. I mean, it comes up in like leadership development as an example, right? And how do you build empathy and that kind of capacity for, feeling right with others. As something that we want to develop, but then how do you do that? So, I mean, do you see this again, not only, and I guess on that clinical side of things, where it's obviously really important in terms of the relationship with the patients or residents, um, but also, I guess in that more administrative and part of our healthcare operations as well?
Oh, I think so. Um, the leadership building example you bring up is great, and the incredible number of interpersonal skills needed from strong leaders is a great example of opportunities for simulation. Um, on the more technical side of the administrative context, we also see things like tabletop simulations where there might be interagency simulations. A great example is, remember a few years ago there was the mass shooting in Toronto,
Hmm.
and um, the victims were all brought to Sunnybrook. Well, it turns out that just a couple of months before that, Sunnybrook had gone through an institutional mass trauma simulation where they worked out how would each of the different hospital units change their priorities and adapt in order to accept an inflow of um, of highly acute trauma cases. And because they'd been through that process, we heard from them just how smooth it was when it actually happened. So you're absolutely right that there are opportunities for those interpersonal um, skills to simulate them for leadership, but there's also opportunities to simulate and help make decisions about some of the um, hospital workflow and capacity building or capacity management type of work as well, and interagency simulations amongst hospitals and emergency medical services and other community-based services as well.
Hmm. Interesting. So I guess that I'm also wondering. I mean, I appreciate it's maybe more emerging, and so you may not have examples to sort of to bring to this, but um, with the growth of AI, right, in our world as a large, right, is that figuring more or differently, I guess, in terms of how simulations are being developed, or what would your perspective on where that future may take us?
Yeah, that's a cool question. So the two perspectives here. One is, how do we train our healthcare providers to work with AI and
Mm-hmm.
understand the strengths and limitations of what AI can bring to their practice. So we see that happening in pathology. We see that happening in diagnostic imaging, where the adoption of AI and the use of AI for pattern recognition in samples and in imaging is starting to become part of practice.
Right.
We see it to some degree in helping clinicians learn how to work with clinical decision support systems.
Mm-hmm.
And again, understanding not just how to use it, but also its strength and its limitations, so that clinicians can understand or flag when there could be an error or a problem with the system. The other perspective is AI in simulation. And
Mm-hmm.
indeed, there are simulation platforms that are beginning to use artificial intelligence and natural language processing. One platform comes to mind. It's a screen-based platform that allows you to meet virtual patients, and speak to them.
Hmm.
So you could be in an office situation, in a hospital situation. I've seen one that takes place on a playground to train paramedics. But walking into an undifferentiated situation where you have to, just like in real life, you have to decide what questions you're going to ask and work your way from broader questions to try to understand what's happening, to more specific questions to come to a diagnosis, or come to an understanding of the specific problem, so you can respond to it appropriately. So now there's these AI powered virtual patients who you can meet and ask anything you want, and they're programmed to give you appropriate responses and help you work through that clinical reasoning process.
Yeah, it's the unpredictability, I guess, parts of that. I mean, that you can bring to that. It's the stories that we read as a kid, right? Make your own ending, right? Follow this, and that's going to lead to this, and things like that. That would be like, a millionfold more powerful, I guess, in terms of what you're describing.
And more complicated too. So those kind of choose your own adventure type of simulations are also very powerful, but they also cue, right? You get a
Yeah.
situation and you're given a little list of answers. Which of these 5 things would you do next or say next?
Yeah.
So there's an element of cueing. As learners get more advanced, you want to expose them to simulations that are more like reality, where someone comes into your emergency room with chest pain, you have to decide what's next.
Yeah. Wow. Very interesting. So, I guess one of the other priority concerns that's being raised during, I guess, our health human resource crisis is that of the mental health of our current workforce itself. Right? I mean, with moral distress and burnout and the challenges that are being faced by clinicians and other professionals alike. I mean, are there examples or evidence about how we can use simulation to help in this area as well?
I believe so. I will say this is more emerging
Mm-hmm.
um, than established practice. I I hear of people using simulation-based approaches to help alleviate some of these issues and some of these challenges, and help support their colleagues. Um, I know of simulation-based initiatives to try to improve resilience
Yeah.
uh, and help um, reduce mental health impacts that way through deliberately addressing the qualities of grit and resilience. Um, I don't I don't know the outcomes. I don't know the state of the research on that specifically.
Mm-hmm.
I'll admit, but I know efforts are being made. Another perspective too is I think to realize that issues of burnout aren't solely related um, to workload and those quantifiable number of hours worked or number of patients you have to care for. Certainly that's part of it. Um, but an important part is also the sense of feeling supported and feeling confident in what you're doing. And there's some evidence, and this came from residency education, a paper I saw recently, looking at the mental health impacts of reducing work hours, kind of crudely, just reducing work hours,
Yeah.
versus reductions in work hours, lesser reductions in work hours, but improving the amount of educational support. And in this case, it included simulation-based education. And adding those supports, including things like simulation, to help the team feel more supported from the educational perspective and feel more confident in what they're doing, helped and had a bigger impact on mental health than just the work hour reductions alone. There's been other studies in Canada looking at again onboarding and regular professional development and simulation in the ICU and retention of nurses. That found that nurses that were onboarded and had access to ongoing professional development through simulation were more likely to stay in an ICU career longer. So we do actually see some outcomes that go as far as retention and mental health in the workplace.
Yeah, well, I think engagement of and giving people chances to learn, I think is certainly identified as an important part of overall retention and engaging them in their career. And so I can, it definitely makes sense to me, I guess.
And another perspective on this too, we've been talking a lot about simulations for educational purposes. Another whole approach to simulation is for system improvement purposes, where you can run simulations with a clinical team. And when you run the debriefing isn't about how could we as providers do better, but rather it's about how could the system in which we work be better structured to support our work and enable us to achieve the best possible outcome. So that's where discussions about changes to policies or procedures, or changes to a certain piece of equipment, or where equipment is stored, or a certain workflow, or access to a certain thing, or the physical layout of a room, can come to light, and improvements can be made in that system and in the structure and in the space. As a secondary benefit of that kind of simulation is that the care teams involved in those simulations now have direct input into their workplace. And it provides an avenue for management to learn from the lived frontline experience of healthcare providers, and empowers healthcare providers to improve the system in which they're working. So that can be another very powerful way to build that sense of collaboration in a care setting, and to empower providers.
Yeah, well, I think it's timely, and I think it's apropos of conversations that are happening right now, right, about the calls for not just improvements to our system, right, not just making incremental changes, and that does have its own value, right, but that we need to take a transformational lens, right, to our systems, and rethink about how, whether it's the Canadian healthcare system, or systems within provinces or organizations are constructed to better maximize, I guess, value and outcomes. So do you think that, in this big moment that we are right now, I guess, in our Canadian healthcare system, looking at changing things, whether that be models of care or scopes of practice or things like that, that simulation has a role to play in that too?
I sure hope so. I would hope that it's involved. And um, again, it could have there's different ways it could be involved too, right? It could be the more computer-based simulation or computer modeling of how a
Mm-hmm.
system would work in order to determine what balance of healthcare professionals or what balance of community versus acute care would optimize outcomes for a population. Um, and that can be structured and modeled statistically through computer-based simulations, to um, types of simulations that involve people in testing new clinical spaces. Like there's hospitals in Canada, as they're designing new clinical spaces, the first thing they do is go to the parking garage and tape out on the floor where they're planning to build certain walls and hallways, and then run simulations so that the care teams can tell them that, there needs to be a door in this location, or we need more storage space right here so we can get to whatever equipment more readily. To developing policies and procedures. So I would, my biased standpoint, of course, would love to see more simulation regularly embedded into these kinds of this kind of improvement and transformational work.
Yeah, well, this is your platform to be wishful and to be inspiring, right? To get people to think about this wonderful set of tools, right, that are, I guess, well within our disposal. It really, I think, what I'm also hearing, right, is that it requires their own imagination in terms of how they use these to solve problems or make improvements.
Yeah. But one of the fun things about simulation is the way it embraces creativity.
Hmm.
Um, whether you're Another example is someone I know used cardboard boxes to build models of different medication dispensing units, and had several nurses try different types of units before they made a purchasing decision.
Hmm.
Um, so there's all kinds of opportunity for creativity.
It's a fun role that you have for sure. Um, and I think like everything, well, I guess one of the things that I guess I'm inspired by what you've shared with me, and I appreciate, I've led the questions, in a way that is related to education and learning as it relates to our people. And that's my own bias, for sure. But I certainly see through your examples a lot, that reminds me of my professional side, right, about learning and development. And I liken it to when e-learning was first coming on the stage and everyone thought that's great, we can use computers to do the things that we were always been doing all along. And so this rush to create e-learning courses that were simulations of what was happening in workshops, right? So the whole e-learning 1.0 was born of just do the same thing that you were doing before, just do it online now instead. And then somewhere along the line, right, there's the aha, but we can do different things that we couldn't do in those workshops using this technology, that brings new value, right, and new learning, that is in fact better, in certain ways. Does that resonate in terms of, I guess, the way that people are looking at simulations? Has the simulation journey been a similar one?
Yes, absolutely. The same kind of adoption curve. And what we're learning is simulation is not the best solution. Just like e-learning, simulation is not the best solution for all educational challenges, right? If we're working on developing very basic foundational knowledge, then simulation is generally not a good or not very cost-effective way
Hmm.
of building that foundational declarative knowledge. But if we're talking about integrating cognitive and psychomotor and interpersonal skills in a complex environment, then simulation is very powerful. Um,
Yeah, and
the other,
that Bloom's taxonomy,
yeah,
right? Sort of getting
yeah,
to those higher order
exactly,
competencies.
exactly.
Yeah.
Um, and the other part of this journey we've learned, and I think e-learning went through this too, is the excitement initially is about the technology.
Mm-hmm.
And there's often massive investments in the technology and purchasing. And in simulation's case, it was the mannequins, only to learn that the technology, having the access to the technology itself is not sufficient to drive change and to drive learning. And the importance of teaching teachers, of professional development, training educators, or faculty
Mm-hmm.
development, depending on your context, is as if not more important. Um, because you can have somebody trained in simulation-based education who can use very creative methods to recreate a simulation, recreate um, a social situation, um, whereas having equipment but not those trained personnel doesn't enable that same kind of learning. So we've also come to appreciate the importance not just of technology, but the importance of people to plan the simulations and facilitate them and debrief them.
So, if you get to go on your soapbox here as we come to the end of our conversation, Tim, and you want to make a call about what's getting in the way of further adoption, use, embracing of simulation in terms of our continued evolution and development in healthcare, what's your call to action?
My call to action is first not to be intimidated, whether it's because you think of the technology that might be involved, or the change in pedagogy, or the change in the way we teach. Simulation really is accessible now, and the place to start is through developing people who know how to do simulations, and that staff development. Um, Once you've got that interest and that energy and that excitement, and you know what needs to be simulated, then you'll know if investments in certain technologies or products are needed or not. The other thing to realize is that many times, especially when we're talking about quality improvement simulations, you don't need a ton of equipment. You don't even need a dedicated space. A lot of
Mm-hmm.
people are doing what we call in situ simulations, running simulations in clinical spaces. So in a bay of the emergency department, or in the operating room,
Mm-hmm.
or in the back of an ambulance. Um, you don't necessarily need to invest in a lot of equipment or to invest in a space in order to enable really high quality simulation based learning. So my soapbox is please be open to embracing it, knowing that technology, and knowing that money doesn't need to be a barrier, and start by finding champions within your system who are interested in learning about it and learning the skills of simulation based education, or simulation based quality improvement, um, and go from there.
And maybe a good plug for Simulation Canada and all of this, Tim. Through the conversation we've been having here today, you've referenced many different studies, case examples, other kinds of resources. Um, if people are interested in learning more about any of those things, about how to involve them, is there a place they can come, or where to get some of
Mhm.
that?
I mean, start at simulationcanada.ca, or feel free to contact us. Part of what we do is teach people how to use simulation, and that professional development part. But we work with our members to help expedite that adoption, and help them plan how to strategically grow their simulation work, and incorporate it into their educational programming, or into their patient safety and quality improvement work. And that kind of advocacy, and that supporting the adoption is really an important part of what we do.
Great. Well, it sounds like you're fulfilling a really important part of our education and improvement sort of ecosystem. So I really appreciate you coming on the show here today to share with us how all of that can be leveraged and used in solving some of today's problems and challenges in healthcare. And yeah, look forward to having you again. Maybe we can talk more around how it can be used in that quality improvement sort of side of things.
Thank you, Dale. I appreciate that you're interested and willing to do something a little that may seem a little more peripheral to human resources, and give this opportunity to explore where there is indeed that intersection.
Super. Thanks again, Tim.
My pleasure, Dale.
You've been listening to the HQ, and I'm Dale Sherbeck, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.